Hello again. I'm Richard Knight, President of the American Association of Kidney Patients. Thank you for joining us for the 47th Annual National Patient Meeting. As part of the AAKP initiated Decade of the Kidney, AAKP has purposefully targeted kidney research as a strategic priority for involvement and impact. Our national and global patient advocates and affiliates have been actively reaching out to all involved in the kidney science and research enterprise to offer their expertise and insights. At AAKP, we know that medical innovation and public policy are shaped by research, and without patients as active partners, future innovations in kidney disease and kidney disease care would not reflect our practical insights and lived experiences. Further, since research impacts public policy, including regulatory decisions and issues related to what new drugs and devices are paid for by government and private insurance, it is critical that patients work alongside research experts. Again, this is why you see so many messages from AAKP about opportunities to join a research project at a university through the federal government or PCORI. Our goal is to populate and impact every single kidney research project underway in the United States and across the globe. And as you will hear, we have been helped by research professionals in academia and government who want to work with you and AAKP. For today's session, Patient Consumers, Elevating and Including the Diverse Voices of Patients, I'm pleased to welcome several presenters whose work and personal commitment are for greater care choice and ending desperate health outcomes among communities who suffer the most from kidney disease. And next up, we are honored to have a good friend and ally of AAKP's, Dr. Claudia Dahlerus, Assistant Research Scientist of Nephrology and Internal Medicine at the University of Michigan, Kidney Epidemiology and Cost Center. Dr. Dahlerus, I turn things over to you.
Thank you. I want to thank Richard Knight and AAKP Executive Board for inviting me to speak today on patient choice and patient voice in quality measurement and research. This work would not be possible also without the support and expertise of my colleagues at University of Michigan, CMS, and of course the patients that have participated in technical expert panels, focus groups, and pilot testing for a new patient-reported outcome over the last several years. So this slide lists all of my disclosures. So here is an overview of the presentation that I'm going to give today. I'm going to start with providing a little bit of background about patient participation in both research and measured development. Then I'm going to move to some examples of patient involvement in the quality measure development work that we have done for CMS to support their public reporting of the ESRD care program. Then the next part of the presentation will focus on new work that we are beginning to do and kind of a future-facing plan for measuring patient choice in quality outcomes. And then I will end with a few key takeaways. So the traditional concept of patient is as a subject of both treatment as well as research studies. So this could also almost be seen as the patient as a passive recipient. There has been a paradigm shift to patients as active consumers of healthcare. Patients are experts in their care and how healthcare directly impacts them. And we know that this is of great importance for people living with kidney disease and having to make decisions about different treatment options. Patients are active and can be active participants in research to support quality assessment of provider care, as well as participate and involvement in treatment and device innovations. The goal of patient participation in quality measure development as well as research is to ensure that the full spectrum of patient voices and experiences in kidney disease treatment are reflected in research and quality evaluations of care delivery. Participation can take many forms. It can be through advocacy, such as the work done by AAKP, the National Kidney Foundation, and many other patient organizations. It can be through patients as research partners in studies, such as those that are sponsored by PCORI. Patients can serve and lead advisory panels that are related to research studies or program evaluations, and then participation of individuals on technical expert panels and focus groups related to quality measures illustrate the patient voice through their expertise as a patient and involvement in their own healthcare. So the next few moments, I'm going to talk about patient voice in quality measurement, and this is going to focus on the work that we have done with CMS over the last several years. So patients have been involved in several ways, and they have made a real difference in the work we do supporting measure development and some of the research supporting that measure development. So as an example, there has been constant and very ample patient participation and leadership on technical expert panels for CMS's dialysis facility quality of care star rating. We've held several panels over the years, and patients have had a strong presence as well as leadership role on those panels. Patients have also served on a recent TEP on dialysis modality uptake, specifically home dialysis modality uptake, and they shared their important experiences and perspectives about home dialysis as well as modality education. And in doing so, they highlighted critical gaps in that modality education based on their experiences, both pre-ESRD and then after having to select an ESRD modality once they reached ESRD. Patients have also been very involved in the Life Goals patient-reported outcome measure that we've been developing over the last several years. And so this involvement culminated in a recommendation from a technical expert panel that we held in 2017. So the panel was equally represented by both patients as well as dialysis providers. Subsequent to the technical expert panel recommendation to develop a new patient life goals measure, we held a focus group with patients to have them review and provide feedback on survey questions, which resulted in some important revisions. After that, we then did cognitive interview testing of the survey with patients, which then helped us pilot and validate the survey with about over 8,000 patients responding to our call for participation in the testing phase over a 2-year period. Both AAKP, NKF, and other patient organizations, as well as dialysis providers, really help support recruitment of patients to participate in that testing. And this really resulted in collecting the data we needed to move on with our testing. So I want to spend a few minutes talking about some future-facing work that we are beginning, and this is measuring patient choice. So there is broad agreement in the community that patient choice should be taken into consideration for measures of treatment and outcomes, specifically for measures that focus on modality selection and outcomes, as well as vascular access, as well as kidney transplant, the decision to be considered for a kidney transplant. The challenge, though, is how to validly measure patient choice. And that can include measuring the choice where the patient decides to defer to the physician's decision about what treatment or modality, as an example, is best for the patient. A simple checkbox attesting that patient does not want a transplant, as an example, may not really convey patient choice. And that's because it doesn't give us any information about the type of education the patient received, the modality of that education, and what may have been most effective for them, and if there was a dialogue that led to shared decision-making. So a simple checkbox attestation is not sufficient to really indicate an informed choice. So defining and measuring choice is another example of the need for patient-consumer involvement in order to tell us and other researchers how choice matters and how to best define it. So there are currently no validated metrics that accurately measure patient choice for different treatment options. Measurement of a patient's choice of modality, vascular access, kidney transplant, and other treatment decisions must reflect an informed choice, and that was made as a result of effective education from the provider. And that would involve the ability to weigh pros and cons of each treatment option in order to arrive at a decision. There are some potential paths for measuring patient choice. So as an example, it could include a question on a patient survey asking whether education or discussion with the doctor or care team helped you make an informed choice. But there will be a lot of feedback that is needed from patients along this development pathway in order to accurately and meaningfully reflect patient consumers' choice in their care, and in particular decisions about dialysis modality, transplant, or type of vascular access. So as part of the next stage of our work, we want to know how you think patient choice should be measured. And so we have a special email dedicated to this, and you can send your ideas to patientchoice@umich.edu. This is on the slides, so everyone should have access to this. So we do look forward to hearing your ideas because this is going to be critical in the next stage of quality measure development. So there are a couple of takeaways I want to end with, and then we can go to potential questions. So research collaboration with kidney patient organizations is a key source of patient voice. So it is important to both establish and maintain relationships with patient organizations. And this is whether it's to support research or work that's being done to support CMS's ESRD programs. There are several kidney patient organizations and their membership bodies that have been pivotal to our measure development work, including AAKP. And as I mentioned in the examples earlier, they supported ample patient participation and leadership on several measure development expert panels. Engaging patient consumers in quality measurement is not just a one-time activity. It's something that has to be ongoing and substantive. This is because the patient as a consumer provides a distinct voice as a healthcare consumer in all activities that can inform policy and quality measurement as well as their own treatment. And I've highlighted some of the ways the patient voice has been represented in those activities related to policy and quality measurement. Patient participation helps researchers, providers, and CMS know that what is being measured or evaluated is important to patients. And I want to emphasize again, just to close, that patients can help drive the ongoing dialogue on how to measure patient choice. I want to thank AAKP again for inviting me to present today. I want to thank Richard Knight and, of course, all our patient partners that have participated in our measure development research over the past many years.
Thank you, Dr. Dahlerus, for another great presentation. We certainly appreciate your insights.